when you have a holiday like Labor Day, we have seen after the 4th of July, we saw after Memorial Day, a surge in cases. What I would really like to see is kind of a full court press to get us way down as a baseline.
But as we wait for that vaccine, the climb in COVID cases continues to rise as we get closer to that Labor Day weekend, with the Midwest seeing an especially sharp increase. Iowa has the largest case positivity rate in the country right now. That's up 77% from last week. Kansas and Missouri also seeing a big increase in the number of cases as school is getting ready to begin again for most K through 12 districts. In Kansas, there have been 1,300 new cases. That's since Monday. And on the Missouri side, almost 1,500 since yesterday's update. Combined, more than 131,000 people in both states have now contracted this virus. But does that mean that everyone should be on guard? You would think so, but the chief medical officers of area hospitals have coined a new term. They call it COVID weariness syndrome, or COWS for short. They say this is dangerous. Many are tired of wearing the mask, tired of social distancing, so much so that they're abandoning all precautions. They warn if we stop taking these precautions, things could get very bad very quickly. KCTV5's Leslie Aguilar is live for us now at the KU Health System. Leslie, are these doctors recommending, or are they talking any words about another shutdown again?
Carolyn, no, they are not. Really, they're just saying that everybody needs to wear masks, socially distance, avoid large gatherings, and wash our hands. They know everybody is tired of hearing it, but say those things are so very important to ensuring hospitals don't face a crisis in the fall.
Chief medical officers, the top doctors from several area hospitals, came together to convey a unified message.
There is a pain that goes with the coronavirus that is unlike anything we've ever seen. And it is much, much, much greater than the pain of influenza. Influenza is bad, but it doesn't hold a candle to what coronavirus has done.
Metro hospitals are stressed right now. It's manageable, but COVID cases are increasing at an almost exponential rate.
We're worried, or concerned at least, that if that happens, the impact on our hospitals and healthcare systems that are stressed right now would actually be greater than we could handle.
Historically, flu season is the busiest time of year at every hospital, so there's a potential for a perfect storm in the coming weeks and months. The simple guidelines of wearing a mask in public, social distancing when around others, and avoiding gatherings of more than 10 people are proven to be effective.
The hottest spots in the country are in hospitals because they have wards of COVID patients, 30, 40, 50 patients at a time, and we're not spreading the infection in hospitals. Why? Because we follow the pillars of infection control.
This case study of infections in Lawrence also proves those guidelines work. The first increase, you see, is when people started gathering again. There's a drop after the mask mandate and bars closing. Then another increase as KU students returned to Lawrence. But the cases are going down again due to all the regulations on campus.
When you do it right, you can keep things open.
Now, chief medical officers also share stories of real patients from their prospective hospitals that exemplify why it's important for all of us to take these healthcare guidelines seriously, regardless of age or pre-existing health conditions. I'm going to share some of those stories coming up at 5. Reporting live, Leslie Aguilar, KCTV 5 News.
Thank you, Leslie.